today. My name is Zach Berger. I'm a primary care doc and internal medicine physician coming to you from beautiful Baltimore, Maryland, and a member of the Right to Health planning team for this webinar. Right to Health is a grassroots organization. It's a movement of volunteers dedicated to pragmatically fighting for health equity. We came together as a team in response to the COVID-19 pandemic based on a shared belief in health as a human right. In our last webinar, we worked to demystify the process of drug development, the politics of drug pricing, and the ways we can fight together to ensure universal and equitable access to the medicines and tools necessary to stop this pandemic and prevent future pandemics. Today, we will dive into the opportunities for and barriers to health worker organizing within and across specialties, professions, disciplines, and levels of training. In light of the ongoing coronavirus pandemic, we'll reflecting on barriers to health worker organizing, as well as exploring new opportunities and ideas for organizing is more important than ever. We'll be discussing approaches for organizing within and for health. This involves organizing health workers around their own rights, as well as recognizing the important role that health workers can play in advocating for and with the patients and communities they serve. In doing so, we'll also explore the challenges and solutions for ensuring health worker organizing is inclusive and representative of our full health workforce. So we're hoping that today's discussion will empower you to connect with and engage in collaborative and cross-disciplinary organizing efforts as a health worker. If you're an audience member that doesn't consider themselves a health worker, we hope this discussion will facilitate the sharing of ideas from outside of the health field and increase transparency and coordination of health worker organizing with broader grassroots efforts. We're going to begin today with a panel discussion with a diverse group of individuals committed to organizing for and within the health workforce. Today's panelists are Zinzi Bailey, SCD, MSPH, social epidemiologist, University of Miami, Shane Ruiz, an Yugen organizer at SEIU UHW, Zoe Sansted, MD, MBA, Chief Resident Physician, University of Washington, and Karim Sari Ahmed, MD, Resident Physician and member, Put People First, Pennsylvania. We're incredibly grateful to have these people here with us today to share their experience and expertise in organizing. But we also acknowledge that this panel is not representative of the diversity of the health workforce overall. And as such, it's missing perspectives that would be valuable in this discussion. It's our hope that this event can serve as a step towards bringing more cross-disciplinary voices into the conversation. While we don't have members of these fields present on our panel today, we want to recognize the invaluable contributions of nurses, physician assistants, social workers, community health workers, and all other health workers in and to organizing efforts. Following our panel and our audience Q&A, we will invite each of you to join us small group, highlight points of resonance, and discuss concrete actions we can each take in this important moment. In these small groups, we hope that individuals from across the health workforce, including fields not represented in our panel, can connect and learn from one another. We have a team of trained small group facilitators who have stepped up to create space for these conversations, and we want to offer a huge thanks to them for taking this on. After all small group discussions, we will once again join together in our larger group to debrief and discuss next steps regarding the actions we hope that each of you will elect to take. A couple of technology notes. All attendees will be muted during our panel discussion. You could submit questions via the Q&A tool at any time. We're going to refer to these questions during our Q&A time following the panel discussion. We'd like to shout out and thank Paula from our team who's typing out closed captioning during our panel. We're also going to record the panel discussion of this webinar to be shared within the coming week. After the panel and Q&A, we will share specific instructions surrounding the logistics for moving to small group discussions. One last word of thanks. We have an amazing team of more than 30 people who have met multiple times per week and put in many hours pulling this together. And I can testify how amazing a team this is. Thank you to all of them. If you're interested in being involved going forward, we'll be following up with information on how that is possible. With that, I am very pleased to introduce to you Milan Satcher, our moderator for this afternoon's discussion. Milan is a family medicine physician and part of the recently formed Health Workers Collective, within Democratic Socialists of America.
And thank you for that kind introduction. I am so excited to participate in this conversation with all of you and with our amazing panel today. So I'll share a bit about my own journey organizing. My own journey began during the Sanders campaign. A group of physician colleagues and I were moved by Bernie's call to fight for systems that put people over profits. And so we worked together to create the group Doctors for Bernie, with the goal of using our voice as healthcare professionals to advocate for a Sanders presidency. We recruited doctors and health professionals across the country to hold events, to phone bank, to canvass, publish articles. And well, we all know the outcome. Bernie is not going to be our president. But in the process, we learned that there is power in the collective, that there is power in working across health disciplines, and especially that the political action and organizing that we take should not follow a four-year national election cycle. And so from the ashes of Doctors for Bernie, we've created the Health Workers Collective within the DSA to educate health workers across disciplines to understand ourselves as just that, as workers connected to a larger labor movement, as well as to critique our position within the larger political economy of capitalism, and to build practical skills to organize our health sector towards a system that will finally prioritize people over profits, with people being our patients as well as ourselves as workers. Over these last several months, the COVID pandemic has shown us without a doubt that we as health workers need to organize together for our patients and for ourselves. This pandemic has revealed the pre-existing tensions between health justice and our political economy, and has highlighted the ways in which our systems have been designed to force choices between health and livelihood. Our systems have been designed to force our patients to choose between feeding their families or seeking care for COVID-like symptoms. Our systems have been designed to systematically undermine and underserve the health of Black, Indigenous, and communities of color. Our systems have been designed to undervalue the role of public health. And our systems have been designed to undervalue us as health workers by forcing false choices between our labor for our patients and our own health and safety, as we saw in glaring view in New York City and cities across the country. We hope that in today's webinar that we'll begin to explore ways that we as health workers can come together across disciplines to begin exploring our barriers to organizing and to imagine the power to change our systems that we could build if we were to work together and organize together. We have fantastic panelists from across health disciplines here today to help us think through this. And so without further delay, I give you our panel. Can each of you begin by sharing a bit about your personal experience with organizing as a health worker? And we'll start with Kareem.
Okay, cool, thanks. Hi, thanks Milan. So my name's Kareem Sari Ahmed, and I guess I started organizing after like college while applying to medical school. I was sort of politicized just like growing up in an Algerian household and having immigrant parents. And then sort of like campus politics around like racism, non-response by administration to racist events on campus, which I think is an experience a lot of people have. But then kind of after that, I wanted to just learn to organize like as a discipline and as a craft. And I was living in Philadelphia at the time, and I was just really lucky to get connected to Put People First Pennsylvania, and that was about 5 years ago. And Put People First is an organization of just everyday folks in Pennsylvania who believe that their basic needs are our human rights, and know that we just have to unite working class leaders in order to fight for them, because just no one's gonna give us our basic rights without some kind of demand and without some power behind that demand. And so I'm really grateful for that experience. So that was, 4 or 5 years ago, and I'm now, now a second-year resident in internal medicine in the Bronx. And I think the sort of ethic that I got of just organizing with whoever you're around is what led me to get more involved with organizing with health workers and residents in particular. Just because when you're a resident, you spend 80 hours in the hospital. And so, like, whether you like it or not, health workers are your community. And you have to find a way to love that community if you want to do anything, and sort of fight against the just vicious profiteering that most of the hospitals and academic hospitals in particular engage in the poor and largely Black and brown communities where those systems often are. And I think just something that I've been learning now, sort of a year into that effort, is that I think we just need to be involved in both kinds of efforts. We need to be organizing as health workers with other health workers, but I think we also need to be members of just people's organizations and not sort of always just be organizing by ourselves on the side, because we don't have all the answers as health workers, though there's so much that we know from being right there sort of in like on the front line of medical capitalism. But also there's just so much leadership that we need to appreciate and lift up from just poor folks who are leading movements and sort of fighting for their lives. And doctors in particular, I think, are in a position where we really have to kind of pick sides in this fight, because the discourse of professionalism tends to kind of confuse us and make us want to defend the interests of the ruling class, because we have this really false idea that we're kind of ascending towards the ruling class, and COVID made that really, really clear that that's not the case, and that's never going to be the case. And we're sort of on the same trajectory as all other health workers. So I'll leave it there.
Thank you so much. A lot of that resonated. Next, we'll hear from Zoe.
Hi, everyone. I'm Zoe. I'm currently the Chief Resident in Family Medicine at the University of Washington. And last year, I was the Vice President of the UWHA, or the University of Washington House Staff Association, which is an independent labor union of 1,400 residents and fellows at UW. So my journey sort of started in college and med school, just being interested in helping underserved populations and being a primary care doctor. I did a lot of work about advocating for the predominantly undocumented Latinx residents in Washington Heights, where I was training in New York, and also advocating for reproductive justice as a then aspiring and now actual abortion provider. But I wasn't that involved in actual like regional or national organizing efforts in med school, which unfortunately I think is super common even for people who are really interested in these issues or very liberal in their personal politics. I think there's a lot of doctors and med students who are just not that involved in organizing. But I got really lucky in residency that I matched somewhere where we had a union, a resident labor union. And so right from the beginning, I was interested in joining and being involved in that because my personal politics were aligned with being pro-labor, and also my mission as a family doctor seemed really aligned with organized labor in general. And then through being a member of the union, I became really involved and eventually became the vice president, organizing residents and fellows, both around trainee issues and also non-trainee issues, but that are still relevant to doctors and that they're relevant to our patients and our communities and our coworkers. And I really want to echo what Kareem said, which is that I think often this is seen as like a this or that, or like you have to choose. And I really think it's all the same thing. And I'm going to make that point a million times today, but it's not one or the other. And I think I had a pretty quintessential like trajectory in that I was like a somewhat clueless new doctor. And then I learned a lot really fast about all the organizing that was already being done in Seattle. I met people from the Nurses Union and the Union of MAs and Techs and SEIU, and we joined like the UW Unions Coalition, and through that I was able to kind of break out of my bubble of only knowing doctors and only understanding doctor issues. And through the union and trying to engage our members, learned how to do things like membership engagement and social media, and how to talk to trainees about issues they care about and get their buy-in. And I think that that's one of the really important things about inviting all people into the labor union movement, and also just organizing in general, is that they sort of get the bug from the issues that directly affect them, but then they learn those tools and then they can use that to impact other issues that don't directly affect them as well. And so specifically at UWHA, I was able to help lead the effort to improve pregnancy accommodations for trainees, which was a huge passion of mine, increase like wages, of course, and then also another big issue of choice for me was protecting residents' ability to leave work for mental health appointments. And so we were really successful in getting new things in our contract related to those things. But our organization has also been able to be a platform for some of our like-minded 1,400 trainees who maybe don't have a lot of time and maybe otherwise wouldn't like try to find an organization that they could be a part of to support things like the anti-racism efforts at our institution, protecting our patients and coworkers throughout COVID-19. So yeah, that's been my journey, and it's been really amazing.
Fantastic. Thank you, Zoe. Next, we'll hear from Shane.
Hey everybody, Shane Ruiz. I am a union rep at SEIU UHW. We represent 100,000 healthcare workers in the state of California. Usually I describe it as everyone who's not a nurse or a doctor in a hospital we represent in the private sector. That includes support services like storekeepers and environmental services, housekeeping, but also direct patient care services like medical assistants, techs, lab draws, all that stuff that is essential to making a hospital run. Often that happens behind the scenes, but that is critical for the basic functioning of a hospital. You know, my story, I come at this a little bit differently than most of the people on the panel. I come at it through politics. My parents were both in healthcare services. My sister and her brother and her husband are both in healthcare. My mom's a nurse. My stepdad's a paramedic firefighter. My sister's a nurse. She's married to a paramedic firefighter. And I was the one in my family that was always like, I'm not doing healthcare. I'm politically oriented. I want to, you know, do, I don't know, something politics-y. And that took me to electoral organizing. I worked for the Obama campaign in 2012 as a field organizer. I became really jaded with electoral politics on its own particularly through the Obamacare fights, and then really not winning anything outside of that stuff in the next 4 years after Obama got reelected. Knowing that really it was Democrats who tanked even getting a public option or expanding Medicare down to 55. I'll always remember when Nancy Pelosi came out and said, we should try to drop the Medicare age to 55. And Joe Lieberman changed his position like 2 days before the vote was supposed to happen, tanking that. So that really shifted my thinking about, well, you know, what is the Democratic Party and how much are we to blame for Republicans always getting their way about taking power and then only getting through about half the damage that the Republicans did in the last 8 years. So it really changed my thinking, and it brought me to the labor movement. How do we, instead of having, you know, there's a tail that the tail wagging the dog problem, I think, with the Democratic Party, where the Democratic politicians tell working people what's going on, like this is what we're going to do, and then the working people have to get with the program, when it should in fact be the opposite, which is that politicians are accountable to a working class base, and that it's their base that is telling them what to do. So that brought me to the labor movement. I have been working at SEIU-UHW for 5 years now, and it's really been an incredible experience, largely because I think, and I know a lot of labor organizers now, and it's a bit different than other unions in healthcare, which tend to be craft unions. And by that, if you don't know what that means, it means that it's about a specific classification. So, even nursing unions, these are craft unions. They're oriented toward nurses specifically. But I work to about as close as what you could call an industrial union, which is a union that organizes everyone in a workplace, as you basically get in healthcare. And we have all sorts of classifications. And it comes with all sorts of challenges, but also strength. So, the challenges are that, we have a lot of internal biases against one another. The respiratory therapists don't like that they're in the union with the housekeepers. They view themselves as closer to the nurses, and they want to be in the nurses union. The nurses union doesn't want them though, but because they got their own biases. And so bringing all these people together, having to work through those problems, though, also brings us strength, right? Because you have to prioritize demands. You have to get people of differing races, of differing classifications, of differing wages into a room together to talk through their problems and to strategize together. And so that's been really important to me. It's made me learn that that it is possible for people of different socioeconomic backgrounds, of different races, to work together. It's not always the cleanest process. Sometimes it's messy. People yell. I've been in rooms where people throw shit, but it's really possible. And it is really, like, when you win, which often we do, it's so heartening to see that people can actually win for themselves and win democratically.
That's fantastic. Okay, and last but absolutely not least, we have Zinzi. Zinzi, if you can introduce yourself and share what brought you to organizing.
So my name is Zinzi Bailey again. I'm a social epidemiologist at the University of Miami Miller School of Medicine. I can't say that there is an official union for epidemiologists, but there has been kind of a larger union that has started recently through the University of Miami. However, prior to this, I would say more of my interest has been in community organizing as opposed to labor, right? So I would say that it's around being able to democratize data so that it can fuel community organizers on the ground. And I'm going to echo what quite a few people have stated, which is that we must not see these kind of the organizing around certain professions to be separate and apart from larger, larger movements that are out there. We must be able to do that. And through this year, particularly with COVID, I've been a part of the health justice advisory committee for the Poor People's Campaign. And so being able to provide information, data, analysis, and that sort of thing, thank you, for the Poor People's Campaign, so that, someone's going on MSNBC, they have the right information and we can talk about it and we can go through it ahead of time and to participate in from that standpoint. I will also say that locally, I'm also involved with Dream Defenders, which is a community organizing group based in Florida. It sprang out of the murders of young Black boys, right? And this has become a much more organized movement where we are intersecting with the Florida Poor People's Campaign, as well as other organizers that are out there. And so that's where I am coming from. Thanks.
Wonderful. I'm so excited to continue this discussion. So to start with, let's talk about the barriers to organizing that you've experienced within this COVID pandemic, but also just in general on how, what barriers you're experiencing, when organizing in your workplace versus when organizing within a residency, when connecting with community organizations, being involved in pre-existing organizations.
I'm happy to go first. Tons of barriers to organizing for everyone, I think, specifically for unions, worse in anti-union parts of the country, definitely easier being in Washington, but based on my experience, I'm shocked that Washington is considered like the #1 union-friendly state because it's still extremely unfriendly to unions. And I think my experience has been unique because I think for some reason, and it's probably mostly historical, and we think of labor unions as a blue collar thing or a non-professional worker thing or a non-white collar thing, which is very, I don't know exactly why that is, but I think that's changing, which is great. But just that perception itself is a huge barrier to getting people in, this is a false label, but like in professions to be unionized. And I think that is also a reason that a lot of medical students and residents think like, why would I be in a labor union? Like, aren't labor unions for nurses? Something like that, right? But I think breaking down that misconception is really important. And it's really important for doctors and especially trainees because we make a lot less money than a lot of the people who are unionized. We make less than minimum wage usually, to see themselves not as aligned with attending physicians and management at the hospital, but to be aligned with the other workers who are equally struggling to pay their rent in their city and have very similar needs for childcare and working too many hours, things like that. And so I think one of the barriers is just getting people to understand like where they fit and who they should be allied with. And I think the other big barrier is just like the culture of medicine and fear of retaliation, and trainees are so exploited and so vulnerable because their whole career depends on not getting fired in residency and like getting into the fellowship they want or things like that. And they've been taught to kind of just keep their head down and make it through these years and suffer, and it'll be worth it. And I think breaking that misconception also is a huge, huge barrier.
Yeah, I'll go. I mean, just from playing off of what Zoe was saying too, like I think one thing that happens is like even we are sort of replicating this in our talk right now, Lo, because I think this is just something that working people feel everywhere. Like people fear retaliation from their boss because they can get retaliated from their boss without any repercussions. Doesn't matter if you're working in a factory or working in a hospital. These are the conditions that people work under. A really good point Zoe made about, people even have this false conception that in a union environment, like, oh, everything's great, well, no, that just even buys you the option to fight, right? Like, but then the union actually has to get their shit together to fight. The boss is still there. They have most of the leverage. They have access to all the resources. The primary fight we're having right now at Kaiser, which is the largest health system in California, and this is happening everywhere, is over PPE. We represent the bottom guys at the totem pole, right? And they also happen to be the most racialized, right? So more Black workers, more Latino workers, more Filipino workers in our union than in the nurses union or than doctors. And so, at some point, one of these administrators brought me a document that said, oh, well, you see, only the procedures that nurses and doctors have to do they need an N95 mask. But if a tech is there with a COVID positive patient, they don't need it for some reason that's inexplicable. And so those are the sorts of fights that you're having to have, right? Like even in a unionized environment, that just buys you the option to fight it. So I do think that that's true. Are we going to talk about like opportunities that come out of this, Milan, or should I just do it right now?
Yes, we'll talk a little bit later about opportunities.
Well, then I'll save that till then.
Awesome. Zinzi and Kareem, I'm wondering, especially you both work across disciplines in really beautiful ways. Are there specific barriers that you've experienced in working across health disciplines and with non-health organizations?
Yes. So I think for me, excuse me, as a social epidemiologist, it seems that I always go to history. And I want to essentially go to inherent kind of power differentials that have come about and hierarchies that are at play right now, but that there's a long American history of labor being racialized, gendered, being categorized by nativity. And that's something that continues today, but in different forms, right? So this is part of the history of this country, and in the same way that other elements of our country are racialized and gendered and all of those things, as we are facing trying to organize, we also have to face anti-racism, anti-sexism, all those other elements that are at play. I would say also specifically thinking, I always think back to like the 19th century, where, you know, we had like skilled trades in the United States, but those were jobs mainly held by white, native-born Protestants, right? If you're an Irish immigrant, you're not getting in, you're not getting into that position, and therefore you're not getting into that union, right? This afforded white, native-born Protestant men the access to strikes, access to unemployment, access to sick time, other things like that. And as we move forward, as like there's great migration, there's a whole bunch of different things going on in this country, you know, it still remained a little bit, you know, divided and racialized and all of those things. AFL, CIO parted ways. There's a whole bunch of, you know, discussions, fights, all sorts of things that are happening. And a lot of that is racialized, I would say, very much racialized. And I would say that AFL and CIO, they weren't able to reintegrate until 1955. However, in that period of trying to get back together, just as one case example, we see this kind of conservative backlash. That's a large political backlash. It's not even a labor backlash, right? Or labor backlash, where there's pushes for privatization, for investment in militarized police. There's disruptions of unions. All of those things are together and are pushing our systems for us not to be organizing together. And all of that is to the end of profits over people. And so I think it's key to see how there have been divisions within our labor movements over time that continue until now to see what we see currently. I don't want to dominate time, but we could go further into some of like key positions that are held by Black, Brown, Indigenous, immigrant people, which creates this whole system of racial capitalism where, you know, there are less protections, there's less ability to organize and to fight. We can get another one of you, and they're only being paid $11 an hour. So like a nursing home certified nursing assistant, let's get another one, right? Like is an effort to kind of get rid of folks, or if you're still in there, be paid part-time so that you have to 2-3 different nursing homes, which is not a great system well for infectious disease. So it's a larger system at work. And before I even kind of, I know Shane has covered some of the like non-nurse doctor health workers, but I think one element that I want to emphasize is the role of community health workers, which is essential to public health and the public health infrastructure, which is one that we do not, or we haven't valued a lot thus far in this country, where by other developing countries are able to mobilize people, where you can talk to the community health workers within a particular community. They know exactly who's having a baby, exactly who needs their medicine when. They know exactly whose house is prone to flooding. My mother was a registered nurse, but she worked in public health in Jamaica. But there were assignments, and she knew going up the hill who needed what. She was able to deliver medicine. She was able to check in on people, tell people what they needed to do, have immunizations, etc. Where I think we've left that behind as something for a developing country, right? As we've moved beyond that, we can go to technology, but I think that there's a key role of community health workers, especially in the United States, in order for our public health systems to work. And I'll stop talking.
Absolutely. So our next kind of area of discussion, and Zinzi, you kind of started talking on it when you were especially discussing about just the importance of the interconnectedness of our organizing. You know, we just discussed the barriers to organizing across discipline. What do you all see as the benefits of organizing across our health disciplines, across our levels of training, across our professions?
Yeah, I guess I can speak to that a little bit. Yeah, because when you describe like the barriers to organizing, and the first thing that comes to mind is like division of the entire working class, and like social isolation that's imposed on the entire working class, and like health workers, I think, experience that very acutely. I think you know, there's kind of an overrepresentation of doctors and on this panel, but I think like social isolation is actually a point of really, really strong connection with the rest of the working class that is like extremely painful, and it connects us with other health workers. But I think also we need to have a way of thinking about how we sort of overcome that. And I think one of the benefits of really working across disciplines, and also just working with people who are different from us in general as a starting point is really essential. I think part of the work of racism and part of the work of the division of the working class is, I think, this idea that we need to go through a very long sort of process to sort of be ready to encounter difference. And until we sort of have this anointed point of reach this sort of anointed status of the initiated and cleansed, then we'll sort of be ready to sort of fight together. But for me, and the sort of approach that I've learned from being an organization with working class people in an organization led by the poor, is that like work is sort of the currency of trust, and you encounter people who are different from you when you commit to doing that. And it's incredibly meaningful, and it helps us overcome those kinds of divisions. And I think, and specifically like across health professions, you know, for the poorest health workers, there is no distinction between like, oh, the community organizations and the work organizations. Like a lot of the people, you know, where I work in the Bronx, they're you know, they're a part of those communities. Like, it's not this idea of like, oh, I'm going to go into the community. That's bullshit. That's not real life. And if our sort of like health worker organizing approach really embraced that, then I think this idea of like, oh, we have to go over there would really be very much flattened. And I think we'd be much more able to kind of just like experience the love and the togetherness of just like committing to doing something together. And like, that's the process of overcoming it. And I think the point of comparison for that approach is like some of what we saw like in response to the uprisings on the part of these like big institutions who are like hurrying to like hire somebody to like be the consultant and like write a fucking letter. Like that's bullshit, you know? And that's sort of over now. and they're like, okay, we did it, we did the things, we're good and holy again. And that's just like not how it works. We need to have like organizations that bring people together. That's how we overcome racism, not by like writing a letter or like declaring certain things or like saying certain words.
Yeah, that got me going, Kareem. Is it good for me to go, Milan?
Yes.
Yeah, I think like I was really that was great. And Zinzi's comments about going to history, like I do think we need to like, when we're talking about the working class, it's not just people who are like going in to do the work. It is everyone who needs to work in order to live, like who doesn't just make money because they were inherited money, and can make money that way, right? And so all of us are the class, right? The question, and the question especially in the United States, is like, we don't view ourselves as a class. Like it doesn't, people don't think of themselves that way. They politically orient in a million different ways, different identifications. We have this very all of us on this panel, I'm sure lots of people on this discussion, have worked in activist spaces, people who already agree with you, who are going into spaces because they are trying to find like-minded people, and that has its benefits. But it also means that the vast majority of people who are usually like apathetic, like don't care that much about politics, are not there. They're not in their spaces. And I think what I believe as a socialist is like, for us to have any meaningful change, you have to get those people to be fighting for politics, to be fighting for a political change. This used to be the realm of political parties in the previous century in the United States. Kinda. In Europe, you saw more of this, and in Latin America, you saw it a lot. But in this country, we basically have two parties of the ruling class, in my opinion, broadly. There are segments of working class people that try to make the Democratic Party, a working class party. But right now, that's not what it is. And it's mostly run by the donors. It's mostly run by these consultants like Kareem was talking about. I worked closely with a lot of those people when I worked in the Obama campaign. And if we want to really have a political transformation in this country, we need a place, and maybe DSA is the beginnings of this, or maybe other organizations are, I don't know what the answer is, but we need a place where all of these struggles of working people are meeting together, strategizing together, and making priorities and pushing the political system in a particular direction.
I just wanted to add a little bit about, I completely agree that the separation is the strategy, right, for weakening any sort of movement, and separating especially the people with the most privilege from the movement. So doctors, for example, and saying, oh, you're not like those other people, you're special, you're not a worker. And I think so much of the work that we've been able to do with UWHA is teach at least our measly 1,400 doctors that they are workers. And it's actually working. People are starting to actually identify as working class and workers and in solidarity with their fellow health workers, which is so amazing to see. And I think I even experienced it, like when you're in med school, I guess it's not only just separation, it's also just like making you so tired and so busy that you don't have time to prioritize like social justice movements and things like that. And it's all of our faults up too for not prioritizing those things. But I think like you go through 4 years of med school and you're just like totally beaten down. You feel lucky to have matched at a program where you make $13 an hour. You feel lucky to make $13 an hour for 7 years to be a neurosurgeon. It's crazy. Like you're totally brainwashed, and you have to undo that brainwashing. And one of the sort of gateways into organizing can be like, hey, I'm going to help you make more money. And then people get a little bit more, oh, okay, this can actually like benefit me. And then they get back into seeing themselves as part of the struggle, as part of the workforce. And I just think it's possible. And I think it's the responsibility of those of us with the most privilege to help make that happen.
Fantastic. So for this last segment of our panel discussion, we really want to kind of move into thinking about, we've discussed some of the barriers that we're experiencing to organizing, barriers related to COVID, not related to COVID, the importance of organizing across discipline, even, you know, not across discipline, as Kareem absolutely said, like just really being community minded and community oriented and being embedded in our communities and organizing for our communities. What are the actions that you see us as being able to take? What are the opportunities that you see for health workers joining together, building power, organizing in this moment? But also, we know COVID is going to pass at some time. So even just long term, what are our opportunities for acting together?
I think that we've kind of emphasized that joining movements that are on the ground moving forward is one key element to moving forward. There can be key elements within our kind of professions or our settings or our hospitals or anything like that, where we can be, from that perspective, getting people more involved in advocating. So case in point with COVID, right? Like in Florida, we have interesting politics and interesting combinations of people. But as we are reaching new heights of cases, then hospitalizations, and we're on that way towards deaths, we're reaching those new heights, right? And we're not moving towards essentially stay-at-home orders or anything like that. There have been absolutely zero, like all arguments have been shut down. So as we've gone through that, I think that is a key issue for all the healthcare providers, right? There is zero, as we're ramping up the economy, we are essentially destroying our health systems. There are record numbers of staff getting sick at our main safety net hospital, Jackson Memorial. We have people, like, they're understaffed. They had to get 100 nurses given to them from the state, right? So essentially, we're just burning through the workforce. And I think it's important for everybody at every level to be able to understand you are seen as disposable, right? So we must be urging our local officials, our state officials at every point that we vote for them, right? And that there are implications for all of us, right? If there are fewer health professionals, there are fewer people who can get seen in a timely manner, right? We are interconnected in that struggle, and there is a role, not for our health professionals to remain quote unquote neutral, but to be able to say, we have an idea of what this is going to produce, and we're going to continue pushing and pushing and pushing to make that change happen.
Yeah, I think to Zinzi's earlier point too about community health workers, like one of the issues is like we don't have a health system in a certain sense, right? Like we have many health systems. And I'm from Florida originally, so my mom and my sister work there as nurses, and I live now in California, and I happen to be lucky enough to live in a state where like the governor just kind of de facto created a unified healthcare system by saying we're running this now. But you know, in most places that's not the case, and I think I do see an enormous opportunity, particularly if Biden wins in the sort of landslide that it looks like he might win in right now, for us to push the country toward like, hey, just as a basic thing, we shouldn't run our healthcare system for profit competitively. That doesn't make sense. Like people die a lot when we do that. And instead we should have a healthcare system. Like we should have, you know, doctors, nurses, healthcare workers, patients come together and like decide how we're spending this money. And so I think that there's a huge opportunity in California, I think, to pass a single payer system. I think, I'm less optimistic about the federal government for all the reasons I talked about earlier, but I think there is an opportunity to push there, especially if Biden wins and this is still going on. We're going into flu season is the other part of this that we're not talking about. And there are big opportunities for us in healthcare to push these things if we're organizing around them and if we're meeting together and pushing in the same direction. But that's the real challenge. And it's always the challenge for the left is, are we pushing in the same direction? Can we get our own shit together to actually do this stuff? But I'm optimistic in a way that I haven't been in a while about it, actually, even though we're in the midst of what seems like despair and crisis. I see people reacting in the right ways. So it excites me.
Do I have time to add something, or do you want to move on to another section?
So after this, we're going to transition into question and answer. So we have time for one more response.
Okay. I guess just I wanted to name like a couple more specific things that are just like popping up as organizing opportunities. And so just like people being evicted, so like rent strikes, those are things that like matter for health workers. Like there are health workers who will be kicked out of their homes, and there are health workers who live in communities where people are going to be kicked out of their homes. And then on the same token, like joining fights that are being led by the homeless, like so many of the problems that are being experienced by so many people are problems that that homeless people were facing already and that we're fighting already. You can look at like the Union of the Homeless, like homeless people organize themselves, and there are leaders who are homeless who are fighting this, and so there are ways that we can support that work. And then another huge thing, of course, for us is like hospital closures. There are just like hundreds of hospitals everywhere in the country that are getting closed, and that preceded this crisis. There's a hospital in my system that was like slated to be closed this year, and then it got turned into a testing site. And for a second, I was under the false impression that like, oh, like maybe this hospital in the poorest part of this, this healthcare empire will be saved because the pandemic revealed that it was a necessary thing. And now the summer came and they're just like, nope, they closed the ICU already. And now they're just like, how can we sort of get this through so that we can improve our payer mix, right? So their agenda is the same. And I think just the other thing I would add, like on all of these tokens, is that so many people are sort of being activated in this moment, and it can be really overwhelming. There's so many things, there's so many fights, there's so many issues, there's so many letters. And I think we also have to have a focus and an approach of really trying to develop leaders out of this moment, like commit to a fight and pick it and stick with something for like a year, long enough so that you can learn the lessons of that fight. And like we may lose them, but the leaders that we develop out of trying to stop a hospital from closing, like out of trying to really like keep people in their homes, teaches us a lot. And the leaders that we develop in those fights are just invaluable for changing the system and winning the big things that we want to win.
Wonderful. So for this next section, we are going to move into our question and answer portion. The first question, just tying it to what we just discussed in terms of actions we can take, hoping that each of you can share limited recommendations on some concrete steps that people can take right now, health workers can take right now towards organizing. And one thing I do want to highlight are our web and organizers will drop a link to a letter that's a petition that's being sent around. The organizers are going to be presenting this to the Biden campaign, really pushing for a more robust pandemic response. So that's one opportunity of a way that people can get involved and help to push the Biden campaign right now. So concrete steps.
Well, I also dropped a link to the Poor People's Campaign, the Health Justice Advisory Committee statement, it is pretty specific around different demands and different directions of attention. I think I'm going to put in a plug for the Poor People's Campaign and figuring out how you can get involved in your state or nationally, and that it's an organizing element, because it's one of the movements that I've found to be as inclusive, and while calling out very specific things around workers' rights, a livable wage, structural racism, environmental protection, key things that are wrapped up in one another. Economic security, right? So I think just taking a look at that, and a lot of the work that the Poor People's Campaign is trying to work on. I know that in each locality, there are specific directions that people are going in, and I would say that is one component to that.
So yeah, I'm going to drop a Zoom link in here. There's going to be a meeting of the Healthcare Workers Collective a week from yesterday, Saturday from 12 to 1:30 for workplace organizing specifically, that I'm helping to put on. And I think it's going to be really crucial in this moment. We talked a lot about like trying to win, reforms to healthcare system. A key way we can be doing that, or a key way that's going to be central to trying to win those victories, actually is taking this moment to also do workplace organizing and trying to unionize a significant portion of healthcare workers. Right now, there are 17.6 million healthcare workers in the United States. Less than 10% of them are unionized. Almost all of those workers are in hospitals and tend to be in the more professional classifications. The most of the healthcare work that's happening in the country is expanding into clinics and not into new hospitals, which poses new challenges for healthcare organizing. DSA has the Emergency Workers Organizing Campaign that is helping workers organize around COVID. So there are some concrete ways that we can try to actually get working people to be self-organized, to have the basic means to protect themselves. And so that's some of the work that I'm excited for us to be doing.
I don't think anything I say is going to be concrete enough to satisfy what I completely understand as a desire for like concrete steps, because that's exactly the question that I would be asking. I think learning about labor unions is something that has taken me 2 years of intense work. It is a ton of knowledge and work that people do their entire career about, and we're not going to be able to teach anyone today like how to form a labor union like in 15 minutes. But I think the first step really has to be like doing the work yourself to find the people that are like-minded and having conversations with those people at your institution. So maybe it's like a reproductive justice group or an anti-racism group. Like usually people who are into those kinds of things are all into the same stuff. And you can use those groups to find other people and then build solidarity from there. Our organization was started by literally like 4 residents who did all the work themselves for like 3 years, and nobody else is going to do it if you don't do it. So you really have to just decide that you're going to do a ton of work and you're going to learn it. And I think like I'm happy to talk to anyone and help teach it. And I'm sure everybody else on this call is too, but we aren't going to be able to teach it in like 15 minutes right now.
I guess a small thing I would add is just like join an organization. It doesn't have to be a perfect organization. There are no perfect organizations. Like on the left, there are no perfect organizations at the bottom. If that were the case, like we would already be united and we would have won something, but we lose. We're just like losing all the time. So just join an organization and like join it with humility and kindness in your heart for other people and with a commitment to bettering yourself and helping other people be better. and you'll learn something from it, especially if you're kind of new and feeling overwhelmed by the moment.
Great. The next question, for those of us with coworkers and community that is more conservative or neoliberal leaning, where we have no union and union is a bad word, are there concrete suggestions for organizing in this time when frustrations among health workers are so high? Like maybe organizing around a petition for changes or something along those lines.
Yeah, I mean, like, you don't start by, so maybe we should talk about this a little, Zoe. You don't start by, we're forming a union. You start by agitating around issues that everyone cares about and showing that you have common interest, right? So yeah, you should, you're not getting PPE. You should at least have a petition on that. You should be marching on the bus. You guys should probably be refusing to work unless you have proper PPE. And if you can pull that off collectively, you need to do this in a campaign, right? So like you need to build, you need to start with small asks, you need to show people they can win small victories. But if you can build a campaign that leads up to people say your shop is going to say, yeah, we're not going into a COVID patient room if we don't have the proper PPE. That's the sort of stuff that leads people to start a union, right? And so absolutely, that's what's great about union organizing, actually, is that it's not this pie in the sky ethereal, it's not winning M4A. Like, I want us to win M4A, it's great, but it feels a little disconnected from our day-to-day lives. But union organizing is about what's happening to people right there at that moment, and how are we best intervening collectively to stop that from happening. And your leverage is your work. And I think that even though people might think union is a dirty word in the broader sense of it, they might have a generally good feeling about their coworkers. They might, they might feel like they don't like their boss very much. And those are the things you want to agitate around, and then start small, start with a petition or something, but then try to grow from there.
Yeah, you can form an organization that's not a union. So our organization existed for 40 years and tried to unionize 3 times unsuccessfully. But if you have a way to connect everyone and act in solidarity, even without union protection, like you're going to have some protection, right? Because they're not going to fire everyone. Like we did a action that was called Wellness Day, where we had all the residents like go to medical appointments on the same day. And even if we didn't have a union, that would have worked, because they're not going to publicly retaliate against residents for going to medical appointments. That would make them look really bad. So you don't necessarily need to use the word union. You don't necessarily need to start with organizing a labor union, like Shane said.
And I'll also add, just from as a Black woman in this field as well, what I found also helpful is just finding those allies around. And sometimes that has to be a lot more covert than other kind of organizing. And sometimes it's that secret Zoom call, or your boss doesn't know you know somebody else. But being able to kind of organize and find your allies outside of your immediate work space.
Okay, great. The next question, I'm curious about the difference between those who enter institutions in cohorts, such as healthcare worker students and residents, compared to those further along in their professions who may take jobs and enter into existing institutional cultures without a new and potentially less enculturated group of people. What does this mean for organizing in these different contexts?
Well, I'll take it. I mean, I think that's what's, again, like, that's what's good about workplace organizing, is like there are always both groups of people. There's always new people coming in, right? Especially in the healthcare industry. It's a growing industry. You can't outsource it to you know, a different country. It's there. It's where it is. A lot of the people who work at Kaiser Vallejo used to be my shop, and a lot of people there were like, well, this is the only job I can get that allows me to stay in Vallejo. If I didn't have this job, I'd have to move closer into Oakland, or to San Francisco. There are new people coming in, and there are people who've been there 30 years, you know, and I think you have to have a really open heart. It is true, just generally, that like people who are around for a long time get used to the institution that they're in, but also sometimes the old people are the radicals. Like sometimes, you know, you can't totally prejudge people. You have to really go in and try to organize everyone and meet them where they are. New people, I mean, the issue often with younger people is they tend to be radical, but they have no sense of like collective action very often. They're very isolated, they're very online, and they don't tend to understand like, oh, you want us to like all get together and march somewhere physically? That seems weird. I don't get that, right? But they have a lot of energy. And so like bringing those two things together, the old and the new, the more institutionalized and the less institutionalized, can often create a lot of power. So I would just try to meet people where they are and then get them to do what they can do.
I think that, yeah, I mean, that question sounds like it's coming from like a health professions student, or resident, and I have like a lot of you know, empathy for that concern, like especially as someone who's sort of a purist. Like I kind of worked in Philly, and then I like went to med school in Philly, and I was like, Philly, I'm never gonna leave. Like the only key to this is like permanently organized communities, and like if you leave, that's whack. Like you have to stick with your people, you know, because that's how you develop leadership in a strong way. And while I still kind of feel that way, the pressure of training for me, like I picked the place where I'd feel safest to do my training, because like residency and like, you know, like healthcare work training is really crushing. And I think the, you know, majority of like people who are trainees will be kind of in that situation where they're temporary like passengers on something. And I think that's okay, and it should be embraced, and like those people should be brought into processes, because even if, you know, they're not going to stick around forever to sort of like lead your campaign 5 years from now, you're like developing leaders, and they're going to move to other institutions. And like, you know, we have good relationships with also like there's this collective of residents like at Yale who are also sort of like figuring out ways to organize outside of formal unions when that's not available as an option. And we like share lessons, and like when people move between institutions, like they take those things with them. So I think we can have that in mind for sort of like a bigger organizing space, which is what we need anyway.
And I would also say that while maybe not creating a huge movement, I've found that people who are not permanent have a way of disrupting a status quo in a way that people who have been like, I'm just gonna accept this, are like, nah, this is not right, right? So being able to ask certain questions from a point of being new and being like, so how does X, Y, and Z make sense? Those are helpful ways of of moving forward and disrupting and having people sit back and think, or at least recognize and reinforce their kind of like biases and that sort of thing. But I think there is utility in that and that disruption.
The next, I'm going to kind of combine two questions that is kind of getting at silos in our institutions and silos in our organizing. So, forgive me. How might you go about organizing residents in diagnostic specialties such as radiology and pathology who are somewhat removed from the front lines practice and may have different priorities from house staff and other specialties? In my experience, lab technician union activism, for example, tends to be kept separate from the residents and the faculty. And with that, I'm kind of pair it with another question about how to explain or argue for solidarity. So in this question, they ask, as a medical student, I struggle with explaining to other students that solidarity with PAs and NPs is important to ensure that we're treated fairly by health systems. These systems take advantage of infighting. How do you argue for solidarity while addressing kind of differing priorities or different concerns amongst groups?
Yeah, this is really tough. I definitely agree with what this person is getting at. I think attending doctors, doctors used to be sort of like their own boss usually, and now they're mostly employed, and they're very mad about that in general. And instead of using that to become part of the movement of workers' rights, for some reason, they're like grasping at staying special. And in that way, they're pitting themselves against APPs. And every doctor organizing group I've been a part of has been completely undone by people starting fighting about this. And it prevents anybody from focusing on the real work. And it's extremely frustrating. And so maybe the 100 people on this call, maybe if 50 of them are medical students or residents, maybe we'll make some difference by at least those 50 not becoming like that when they're attendings. But I don't have like a lot of ideas about how to convince employed physicians not to just use all their energy hating people that they see as competing against them. But I share completely the frustration and the feeling that it's just totally in the wrong direction and really distracting from how we can work together. And I think that maybe, and it's kind of lame to say like education is the key to everything, but it kind of is. Like if you can teach people when they're younger or earlier in their career to have solidarity with other workers, perhaps they'll be less likely to see themselves as so separate in the future. But that's all I got. I don't have any other great ideas, but it's horrible.
Who wants to go first? You want to go first, Kareem?
Sure. I guess on that specific point with like among the specialties and stuff, I think like knowing what's going on and just having relationships with people is a really important point, because like the conditions we're in right now don't allow for a ton of solidarity between like radiologists and like other health workers. But like one day, like this, the hammer's going to come down on the radiologists and they're going to be in crisis and they're going to need help from someone. And when that happens, if your organization or you and the couple like colleagues of yours are there to support them, they will never forget that shit. But focus too on like, maybe radiologists aren't the easiest to organize, but also like, I think a lot about like OBGYNs and like surgery folks who have like the most crushing working conditions, so that it's hard to even like find an opportunity to talk to them. We spend a lot of time thinking about how we just like show up for them and like be kind to them, because like all kinds of shit goes down in those departments. I'm internal medicine, like and like opportunities will arise for you to show up for those people, and if you like organize with that in mind, always looking for the opportunities for any group of folks, like then that will be very like long lasting if you can act on that.
And I will go back to history again and just say that essentially, I think that there has been a fundamental disruption and co-optation there's co-opting of public good and common goods in this country. So it's hard for us to think beyond ourselves or our profession. And I think that there's a broader argument to be made for arguing for common goods for the public. I was shocked when I went to, it was a conference of sorts with formerly incarcerated women, and someone stood up and said, oh, anything that is associated with public means Black, brown, and subpar, right? So public health, public transportation, public school. So whereas at the original point, it was supposed to mean collective, it now means something derogatory, right? And I think being able to, on a personal level, be able to share common goods, maybe goods that you can't see, with other folks across different professions and positions, that will be helpful for building that foundation for organizing.
Real quick, I just wanted to say that I wanted to also echo what Kareem said earlier, and about I think you should burrow into your institutions. Like, there's this thing with radicals often that, like, they have the meeting and then it doesn't go well, and they're like, oh well, screw this. Like, it doesn't, it didn't just happen because I called the meeting. So it takes time. You have to build relationships, identify who are the organic leaders in these departments, who bakes the cake, who plans the birthday parties, right? And get close to those people. Maybe they're more conservative, but you should build a relationship. So when there's a problem, that's when you intervene, like Kareem was saying earlier. And we forget time sometimes, I think, as organizers. We think everything needs to be solved right now, but time's going to happen. Like, things are going to keep happening. And we just need to have organizations where people can come to talk about this, to prioritize issues, to work together, and hope that the problems that present themselves will force people to see that actually their interests lie with working together with their fellow coworkers and not with assimilating themselves to the owners.
Fantastic. Well, I just want to thank all of you for your time and sharing all of your experience and your hopes and vision. At this time, we are going to now transition over to Amu, who's going to set us up with small groups. I do just want to say we unfortunately weren't able to get to all of the questions, but we will, what we'll do is we'll do our best. We'll copy over the questions and we'll try to answer them. We'll try to still get you answers for those. Thanks.